The Field Epidemiology Training Program Frontline is a 3-month program that targets surveillance officers at the district level. The purpose and the main goal of this program is to improve the epidemiological capacity of the Ministry of Health in Uganda at the district level. This program was introduced in Uganda in 2016, and since then we have trained over 600 frontline graduates in about 125 districts. So at least we have one frontline graduate in these districts. However, we have districts that do not have this capacity, up to over 20 districts. And of these 125 districts, some districts only have one graduate, which is very low for us to be able to improve this epidemiological capacity. The key competences that we want to achieve when we train the frontliners, public health surveillance, we expect them to improve in field investigation, their epidemiological methods, and their ability to communicate these findings, both written and oral. From the program, each graduate is expected to have a certain level of competences in order for them to graduate. And from this, there are projects that they do. So the program is tailored in such a way that we have frontliners coming to study or come together in a workshop 3 times in these 3 months. So every month we have 1 week where they come together for them to study. And when they come together, in the first workshop, it's all study. In the second and the third workshop, they are expected to present the work that they have done between workshop 1 and workshop 2, and between workshop 2 and workshop 3. This work is work that is based on real-time data from their districts. When they present this to us, we expect them to do the same at their district in order for the district leadership to understand the surveillance within. Between workshop 2 and workshop 3, we expect them to do a problem analysis, a data quality audit, and to have conducted a case investigation as well as an outbreak investigation. Now, the data quality audit is to help them improve whatever surveillance gap there exists within their district. So our mandate is to improve within their district. And we have seen this improve. For instance, there are some districts that did not have reporting occurring, especially on the side of animal health, and we have seen this improvement going from 0 to almost 90%. So the program has had impact not only on the human health side, but on the animal health side and the environmental health side. We have seen frontliners taking part in case investigations that are crucial, outbreak investigations that are crucial. An example in point is the Ebola outbreak of 2020 to 2023. Frontliners were key in some of these investigations. As much as we are talking about frontliners being in these districts, they are few. In order for us to be able to improve surveillance, remember, each and every public health event, we want it to end at the source. So Frontline as a program is crucial for us to be able to end every public health event at the source. There is still a big gap, and this gap is seen in the districts that have not yet are being trained, but even the districts that have one trained personnel, but also these personnel are constantly moving, because we know they get promoted, they get other opportunities, so there is a gap that still exists. And if we are to achieve our agenda to end all public health events at the source, we need more frontliners.